So now that you've filled and flushed multiple times and you've got the descending colon and some of the transverse colon, we'll talk about how to get water over into the ascending colon. So you're going to take some water in, lying on your left side, and then holding the water in there, you're going to roll onto your back. And it's easier when you're rolling onto your back. If you want to get the water there, if you're on your back and you put your feet up so your knees are up and your feet are flat on the floor, and you do a little elevation, so you lift your butt off the floor, gravity will then have your butt higher than your intestines, higher than this part of your intestine, and water will move up in that direction. Now then you could lower yourself and roll gently onto your right side, and water will move across into the ascending colon. If you've moved over to there and you, in any of this process, you get some more discomfort, you can pause, breathe a little bit, not let more water in, just let the water settle. If it feels like you really need to expel, then anytime you're feeling that discomfort and you need to expel, roll back on your left side so the water will come out of here, and then get up and expel. But let's assume that you've filled and expelled many times and now you're lying on your right side. You'll find that if you're lying there, and sometimes this is a little harder side to get things out of, you're lying on your right side, you might want to take your fingers and gently palpate your abdomen. And usually it's a lifting motion. So if my right side's lying on the floor, I'm getting in a little bit, I'm catching some tissue, and I'm gently lifting to try and get some of that areas to loosen up. And you can go all the way from right below the ribs, all the way down to near your pelvic bone on the right side. And you might find any of those areas have a little bit of discomfort, and as you lift and massage it, you'll feel like something's starting to break up in there, or you might get some gurgling. You might feel that. So again, once you've gone to this side and you've gotten some of this loosened up, always go back onto your back. When I've had water in the ascending colon, I want to be on my back, and just like when I was trying to move it up, I'll be on my back with my knees up and my feet flat on the floor, and I'll do a little lift of my pelvis to get my bottom higher than my head, and the water will roll out of, the water, because of gravity, will come out of the ascending colon and it'll move into the transverse colon. So how long would you be there? You might be there 10, 15, 20 seconds if you're comfortable. Some people are not comfortable lifting their bottom off the floor because they have low back issues. So if that's the case, they might take a yoga block and put that under their sacrum so that they can rest on something comfortable. And they could rest there for 10, 15, 20 seconds. If you're comfortable and you have been experienced at it, you might even be able to rest there for 30 seconds to a minute to let all the water drain out. Now it's moved into the transverse colon. So now you can remove the block or let your bottom down, roll onto your left side again. Now you're laying on your left side and you're letting the water come across. If you've gotten water into the ascending colon, it would be a good idea while you're lying on your left side to go in and do a little massage on the ascending colon, and you're trying to move things along so that it gets over here. So you might find that if you're in there and moving and manipulating the intestine a little bit, again, don't punch in hard, it's a gentle manipulation, you'll find some gurgling, and then things will feel like it's moving across, and then get up and expel. So it's important when you're filling and flushing, and I really want to clarify what filling and flushing means. I said in the beginning that the amount of water you take in the beginning may not be a whole lot. Once you've done 4 or 5 or 6 or 7, it depends on how many fills and flushes you need to clean your colon. Once you've done multiple fills and flushes, you'll find that usually there's more room to take in more water. How much water do you want to take in? It's really dependent on the size of your body, and it's dependent on how you're feeling. So if you've been doing an enema for over an hour and you're starting to feel exhausted because you can lose some electrolytes and you can feel tired, you may not want to be taking in too much. You'll have to do it based on your energy and how you're feeling. But some people, I would not say many people, could take in a full bag. This size bag is very large, but for most people, when you're using the normal pink hot water bottle, after you've filled and flushed multiple times and the intestine is pretty clean, you could usually get in a full bag of water. I would not recommend more than that, because you don't know exactly what your capacity is during the time. So I'm going to suggest a full bag of one of those pink ones, which is a little bit about 2 quarts. That's plenty of water, but I also know that I have some patients that are like 5'1" and weigh 104 pounds, and that's too much water for them. And obviously, if you've had any kind of colorectal surgery, this is not only not indicated, but then you'd really not be wanting to do this. You'd want to be very careful with the amount of water you put in. The other issue about the amount of water is down the road, as you've been doing more enemas and you're feeling cleaner and clearer, you'll find that the more water you put in there, and you can do it comfortably, it will also help you realign your intestines. And you'll find that over time, if you've had some areas that are crimped or not working very well, as you can get more water in, it'll actually straighten things out in there. So now that you think you've finished your enema, let's make sure that it's complete. Occasionally water will hang in the intestines, and it's really important that if you feel like you have any water in there, you really might want to move it along manually by manipulating your intestines, because one of the things that usually people have experienced is that sometimes they think all the water comes out, and then maybe an hour later they feel like they're going to pass gas. It's really important to make sure that, since you don't want to pass gas at any other time when there's water in there, that you learn how to drain your intestines. Usually what I will find is that if I tend to do my enemas at night, because then I can lay down afterwards and I can, I can lie on my left side mostly, and I can manipulate my intestines a little bit and move things along. And so maybe it's a half hour, an hour later, and I'm lying there and I feel like something's moving along and I feel like I'm going to have to pass gas, and that's when I'm going to go, and there'll probably be another elimination. The other thing that you can do, if you're comfortable with it, is that some people find that when they're showering after an enema, the natural position for eliminating is squatting. And some people will squat in their shower and they will manipulate their intestines again, and it will get out some of that residual water. So it's important not to ignore that, because if you have an accident, you're not going to find it very enjoyable. The other piece about finishing an enema is people are always wondering, how often I should do this, what I should expect afterwards. Usually, you're not going to eliminate for a day or maybe a day and a half after an enema. That doesn't mean you're constipated. That just means your body is pretty much emptied out, and it's going to take a little time for motility to come back. So don't worry about it. Don't plan on doing another enema right away. Just let your body start to reestablish its own rhythm. The other thing that I'd recommend is, if you want to, you could either include a little healthy bacteria. So now that you've filled and flushed and you think you're all done, if you want to do one more fill and flush and put some healthy bacteria, you can buy acidophilus in capsules or in powder, and you can put it in the water, and you do what's called an implant. And so you could put that in so you get healthy flora in that way. The other way to do it is just take it orally as a capsule or a powder, so that you can reestablish healthy bowel flora, because that can take a little bit of time to do that. So either way you want to do it. Now, one other piece about doing enemas, and I'm sure someone's told you, a coffee enema is better, a wheatgrass enema is better. There's many ways you can do it. I'm strongly suggesting that you start with doing water enemas to begin with, because coffee and wheatgrass do work, but they're going to make the bile duct kick really hard. And so some people, if their first enema is a coffee or wheatgrass enema, they'll let the water with the coffee or the wheatgrass in it, they'll let it in, and then they're going to feel nauseous. They're not going to feel good at all. They might feel like they have to expel immediately and they can't take any more water in. So remember, that's more for a much later stage, after you've gotten used to what an enema is like, you've filled and flushed. And typically what I will say when someone thinks they're all done with an enema and they've done multiple enemas, let's say over a 2, 3, 4 month period of time, and they know what their body's doing, then you might want to finish with a wheatgrass enema or finish with a coffee enema. But I always have people do a water enema first with multiple fills and flushes till their colon is clear. And what do I mean by clear? That's an important distinction. So how do I know when I'm done? I'm going to fill and flush until what's going in is water and what's coming out is water. And when I palpate my intestine, when I'm pushing in, maybe in the beginning I had some places that were uncomfortable. that were slightly painful, that had a lot of resistance. And I'll find that as I fill and flush repeatedly, that pain, discomfort, pressure goes away. And again, how I'll know that is at the end, now I'm taking water in and I'm pushing and I'm manipulating and only straight water's coming out. I know that I'm completely clear. How many bags does that take for some people? Depending on your history, it could take you 10 or more bags of water. Again, on the 1.5 quart, 2-quart pink water bottle. This is a larger size. This holds more. But it can take as many as 10 or 12 before you're completely clear. If you're exhausted anywhere along the process, please stop. Don't do 10 or 12 bags. You have to respect what your body can handle. It's very important. The other thing is, when you say, how do I know if I'm done? Sometimes you're opening up bowel pockets that have been there for a long time. You may get something out that's really uncomfortable. What do I mean by uncomfortable? You may get to the place where something that's passing through you makes you feel hot, cold, headachy. You could get a funny taste in your mouth. You could smell things. You could smell it when it comes out and be really bad. And sometimes what comes out is extremely acidic, and it can hurt or burn your rectum. When everything that's been coming out before isn't burning, and suddenly you release something that smells bad or feels bad, you know you probably broke open an old bowel pocket where there's old fecal matter in there. And if you've had that experience, it would be good to go back in when you got that out and do one more fill and flush, or maybe more than one, to get out the rest of that. Because if you had a bad experience if it's painful when it comes out, meaning it burns, and none of the other ones were burning, then you might still have more of that stuff in your intestines. Another way to know when that happens is when I've opened up a bowel pocket, sometimes I'll go from feeling relatively good, energy's good, I'm feeling light, and suddenly I open a bowel pocket and now I get a really bad headache in one side of my head. So maybe it's on the right side. Generally, the way to think about the intestines is if you have a pain or discomfort anywhere on the right side, it's going to be the right side of your intestine. Pain or discomfort anywhere on the left side, it's going to be the left side of your intestine. So the obvious answer is you get a little headache pain, you get a postnasal drip drain down the back of your throat on the left side. You're going to have to fill and flush a little bit more on this left side because it reflexes, connects to that left side. You get it on the right side, you know you're going to have to go through a little bit more involved process because getting water over to that right side requires you laying on your left side again, eventually moving to your back, and eventually rotating to the right side, and then getting that out. So depending on where your symptoms show up, you're going to know, oh gee, why was I feeling so good? And now suddenly I have something that feels very uncomfortable. What do I do with that? So how does an enema feel that works well for you, and how do you deal with it when it doesn't always feel like it's working well? When I'm letting water in and out, and no colon is really an exact straight tube like you see in the pictures, sometimes water goes in very easily and comes out very easily. But the times where you're going to have a little bit of difficulty is when it doesn't seem to go in easily and it doesn't seem to come out easily. And in those parts, you might have some narrowing of the intestines at certain places, and the water just doesn't seem to want to fill in very quickly, or it was filling in earlier and now it's not. Now, if it was filling in easily before and now it's not, you can guess that some fecal matter probably moved lower into your intestines and is on its way out. And as it's hitting there, it may be more compacted, or it may be a larger bolus of fecal matter. And at that point, you just want to let water in and gently massage. Again, the goal is not to push really hard and cause acute pain, but you want to loosen things up. So you might wiggle a little bit. Just get in there and move it a little bit. Likewise, if you have some narrowing in an area, you might want to let water in, cut off the diverter, and hold the water, and then you might want to move around a little bit. So if you're lying on your back or your left, I would recommend get on your back, have your knees up and your feet flat on the floor, and again, elevate your bottom and just do a little bit of breathing and moving to see if you can loosen some of those areas up. If the pain is particularly sharp, or the pain is really concerning you in any way, clearly you want to eliminate and stop. But sometimes you'll find that when the pain feels like a little bit of a contraction there, especially for women that are used to abdominal cramping from their period, they'll know that sometimes if they breathe a little, that will start to relieve. For men, they don't have that experience, so they can't compare to that. But what you might want to do is keep the water in there for just a short time, a minute or two. I've never, ever recommended retention enemas. You're not holding them for 30 minutes. You're not holding for any length of time. So you're going to hold it in there for a minute or so, if you can comfortably do that. And then as you've moved around, you might find that it loosens up, or the spasm starts to go away, or the contraction starts to go away, and it feels like, oh, I could take more water in, or water comes out easier. So the goal is to not persevere through severe pain, but at the same time you want to try and loosen up any area where there might be some narrowing and the fecal matter can't get through there as easily.